Have you ever been curious about the requirements for becoming a medical lifesaver? Imagine being the person who contributes in the diagnosis and treatment of cardiac disorders or helps save lives amid heart attacks. I'll be speaking about what it takes to become a registered nurse and what an emphasis on how to find employment in a cardiac catheterization lab, also referred to as the cath lab. So my main points I'll be discussing in this speech are the responsibilities of cath lab nurse, the required education and training, and experience in tuition reimbursement. So the length of the program. It's a common misconception that much training is necessary to become a nurse. Most registered nurses programs, including cath lab nursing programs, take about 2 years to complete. Then a couple months more for the cath lab training. This is from Yanera 2023. So some prereqs though to get into the nursing school. Students are required to finish all 34 credits in prerequisite courses, a foundation of subjects like anatomy, biology, and psychology. All of these are required for you to join the CSN nursing program, but it varies at other schools. I know that. So the nursing program though at CSN is an additional 34 credits that are made up of clinical rotations and foundational nursing courses, which will teach you the basics of nursing skills, including patient evaluations, medication administration, and patient care procedures. All right. So once you finish your nursing school, you are required to take a state licensure exam. So this is called the NCLEX-RN exam. So once you pass the exam, you will get your state license. This exam ensures that every nurse has the necessary skills and knowledge to provide patients with proper and effective care. All right. So what experience/tuition reimbursements are there for becoming a nurse? So if you want to do the route that I'm doing, you're going to become a CNA first. This work is very valuable in the hospital because you're one of the lowest people in the hospital, but you're requiring very necessary experience to work up the food chain. So you're going to be working with RNs, registered nurses, with their patients, and you'll be gaining some benefits through the hospital, which can include tuition reimbursement, scholarships, or other tuition assistance to help you go through nursing school to become a registered nurse or even a nurse practitioner. But also working from the bottom up allows you to get some networking in because you'll have the ability to work with physicians, other nurses, and other medical professionals, which will help expand your um, basis of people that you know. All right, the cardiac catheterization lab. So the role of the cath lab is a very specialized department in the hospital called the cath lab. It's where cardiologists and nurses diagnose and use interventional procedures to identify and treat cardiac disorders. Cath lab nurses are essential to cardiologists' work because they aid in treatments, keeping an eye on patients' vital signs, and offer post-procedural care. If you're like me and you share passion for the heart and its complex functions and workings, then working in the cath lab is a no-brainer. It gives you the opportunity to have a big influence on patients' lives by protecting them from heart attacks, arrhythmias, and other obstructions in the coronary arteries. These are just a few of the cardiac diseases that cath lab nurses may assist in diagnosing and or treating, with the help of a cardiologist, of course. But there's also pretty good financial incentives. Cath lab nurses make some very competitive pay with an average hourly rate of $35 and an annual salary of about $76,000. But there's also a lot of room to grow and maybe become a cardiologist or a nurse practitioner or even head like lead nurse working in the cath lab. In conclusion, completing nursing school and attending some real world experience by becoming a CNA will help me fulfill my dream of becoming a RN working in the cath lab. Every stage of this goal is very important to helping me achieve this goal in a in a relatively quick process, but also with little debt to my name. If you're really enthusiastic about improving people's lives and thriving in high stress situation, then this may be a route for you as well. It is both realistic and satisfying to pursue this career path in the cardiac catheter lab, since there is a clear road to RN licensure, as well as chances for financial assistance from the hospital. And it's also a very lucrative career. That is all. Thank you for listening.